Good morning and warm welcome to all delegates, my seniors. At the outset, I must thank Pune branch for proposing my name for the CKR Oration. I also thank the judges panel of CKR Oration. Dr. CKR, introduced by Dr. Nagaraj. This award is constituted by IAH Tamil Nadu branch in the memory of legendary occupational health physician late Dr. C.K. Ramchandar, past president of IAH and mentor to many occupational health professionals. His ambition in life was to ensure that the specialty of occupational health is popularized widely throughout the country. The topic for my oration is new normal post-COVID and readiness for future pandemic. COVID-19 starts in 2020. In fact, COVID started in December 2019, and that is why it is named as the COVID-19. The first case of COVID-19 was detected in December 2019 in Hubei province, China. In January 2020, the World Health Organization declared the outbreak of new coronavirus disease in Hubei province, China, to be a public health emergency of international concern. 2 months later, that is on 11 March 2020, the WHO declared the coronavirus COVID-19 outbreak as a pandemic. Followed by that date, Government of India declared lockdown on evening of 24th March 2020. Ensuring safety and health at work. What is most affected is the workplace. A lot of gatherings at many workplaces, and that was most affected during this COVID pandemic. ILO guidelines ensuring safety and health at workplace for pandemic is published in 2020. The report highlights the occupational health and safety risk arising from the spread of the COVID-19. It also explores measures to prevent and control the risk of contagion, psychosocial risk, ergonomic and other work-related safety and health risks associated with the pandemic. We all are occupational health physicians working in various industries. Few are working in unorganized sectors also as a voluntary, and we being in a preventive health, occupational health physicians. So we have to concentrate on its workplaces for the prevention of the spread of this disease. Occupational health physicians have played a crucial role during the pandemic management and business continuity. Unless business is continued, what will happen to the economy? Economy of the country, economy of that industry, what will happen? So the best role played by the occupational health physician during this pandemic at the workplace was very crucial. Effect of COVID-19. What COVID has not affected? Human life, economy, everything. Worldwide, almost more than 66 crores of people were affected by the COVID disease. It took lives of more than 6 million. Recovered cases were more than 63 crores. It has got a very devastating effect on everything. The global economy has lost nearly $8.5 trillion in output over the last 2 years due to the COVID-19 pandemic, wiping out nearly all gains of the last previous 4 years. Look how it was affecting economic and human life. This was a reference from the UN Department of Economic and Social Affairs. India to overcome COVID-19 pandemic losses by financial 2035. The COVID-19 pandemic effect on workplace. 61% of the global informal workforce are vulnerable during the pandemic as they have faced occupational health and safety risk due to the lack of sufficient protections. Informal work, migrant workers, they have suffered a lot. There was a chance of losing the job, no protection. The lockdown and related business disruption, travel restrictions, school closures, and other containment measures have had a sudden and drastic impact on workers and enterprises, affecting everything. COVID-19 pandemic was an immediate health emergency. Measures to address the pandemic also have a direct impact on the markets, supply chain, production, services at the world of work. History of pandemic. We are seeing pandemics emergency frequently, not once in a lifetime, but in fact every few years, and we need to start preparing. This was a sentence by Jacob Lemix, Harvard Medical School Assistant Professor of Medicine at Massachusetts General Hospital. It is no longer a debate whether will be another pandemic. The only question is when it will hit us. This is a brief history of the pandemic. Way back in 430 BC, the first pandemic was noted, and in recent years, like in the 20th century, Spanish flu, that is influenza H1N1, took lives of 20 to 50 million. In 2009, influenza A, H1N1, took lives of 2 to 5 lakh. And the recent pandemic of COVID-19, who took lives of more than 6 crores of people. What we have to learn from the COVID-19? It has given a great lesson to us. You can't prepare for everything. Health and wellness are critical parts of health, safety, and environment program. Workplace health applies whenever your employees are working. They are not only in industries, they are at various places, malls, grocery, and whatnot. So we have to take care of all employees wherever they are working, at all places. A significant event like COVID-19 can impact all industries. And specifically, we have learned a lot how to take care of the people and how to save the industries from the losses of economic point of view. Caution package can affect all industries. Occupational health safety at workplace. The COVID-19 pandemic proves the crucial role of occupational health for safe work and protecting the health of the workers and the larger population too. The interrelation between the occupational health and public health is crucial for future pandemic preparedness. Public, public health sectors trained in a BOHS have a crucial role to play in occupational health and shall play a particularly important role in addressing the unorganized sector group of employees for occupational health. This initiative has already started by IOH India, and at branch level, we are promoting BOHS activities. And in these conferences, 2 branches even got award for these activities. So we are already set up this program in our association. This is credible. Post-COVID-19, various studies report more than 50% of the employees around the world have suffered significant damage to their health due to COVID-19. COVID-19 has affected mental, social, and physical health also. Occupational health and safety management system, integrating emergency preparedness, the implementation of preventive and protective measures to be carried out in an efficient and coherent manner. This has to be implemented effectively at all levels, and that too in a coherent manner. Management and worker shall be involved in the process at their level of responsibility. It is not only management or higher authority or employer can manage everything. No, you have to take your workers into confidence, and they also have to be given some responsibility for the prevention or spread of the COVID. Provide a relevant information and training to all members of the organization at all levels, including the regular mock drills for emergency preparedness and response procedures. Mock drills during such hours is very important and is crucial, as we do mock drill for various audits in the factories. So likewise, you have to do mock drills, take a mock drills during such pandemics to make the system more and more effective. Business continuity. Unless business run, nobody will survive. The whole economy will get paralyzed. A business continuity plans needs to be developed with the full participation of workers, will help identify the risks that might affect a specific business or organization in times of crisis and devise strategies to reduce their impact. The plan should provide in a practical way to reduce the risk of workers' exposure to a disease in the workplace. This may include medical care, promotion of personal hygiene habits, and changing the work organization to minimize human-to-human contact. The management and worker has to think, sit, and plan, and how can we minimize human-to-human contact for prevention of this dreaded disease. Frontline workers are most affected. It may be any industry, hospital industry, grocery shop, malls, and so many. Hotel industries, cinema theaters, wherever the frontline workers are there, they have to be protected. Promotion of mental health. Experience shows that violence and harassment, both physical and psychological, can rise during an outbreak, in addition to an increase in a social stigma and discrimination. Occupational safety and health measures should be implemented to prevent and reduce the psychosocial risk, including violence and harassment, and promote mental health and well-being, in addition to preventing the risk of long-term repercussion on the workers' well-being. In time of this infectious disease, because of ill health, because of loss of economy, the psychology of the people changes, and they may react in any form. and we have to take care of this situation. Mental health, stress, psychosocial risk, violence, harassment. Fear for one's own well-being or that of family members and co-workers who might contract the disease. Tension between the established safety protocols and the desire to care for or support individuals, example, ensuring safe burial practices, isolations, and implementation no-touch policies. Difficulty in maintaining self-care activities such as exercise, good eating habits, and getting enough rest. Promotion of mental health. Promotion of the mental health is crucial as a part of readiness for pandemic. Because your mental condition should be at a sound. Otherwise, the future will not be good. An estimated 15% of the working age adults have mental disorders at any point of time. Depression and anxiety are estimated to cost the global economy of $1 trillion each year, driven predominantly by loss of productivity. People living with severe mental health conditions are largely excluded from the work despite participation in economic activities being important for recovery. Usually, it's a human tendency. If there is some mental disorders, the organizations, instead of retaining them, they try to remove them from the working places because they have fear. He may or she may damage to some other things, or there may not be qualitative or quantitative production from him or from her. Risk management, ergonomic, physical, environmental, and chemical wages. We know 8 rules of ergonomics. There is a control hierarchy. And in a control hierarchy, we have to give a most important to the effective method. And which is the effective method is elimination. And the least effective method is personal protective equipment. But during pandemic, there was no alternative than using a PPE. Information sharing culture. There should be a governance and accountability. There should be a transparency, training and awareness. During any pandemic, there is a rapid spread of information of all kinds from multiple sources, including rumors, gossip, and unreliable information, which may create a panic in the general population. Risk communication is one of the key pillars of response to outbreaks. Environment, social governance, ESG, which is called popularly ESG. ESG is a way an organization can focus and measure the sustainability and societal impact of their investments. Instead of measuring an investment based on a cost or financial impact alone, with ESG, overall health is measured by the balance of these 3 categories. Environmental policy, performances, climate change, resource depletions, bioavailability. Social, work policies, employee experience, universal design, wellness and safety. And governance, ethics, policy, diversity, equity, and inclusion, accountability. The ESG is the best way to adopt. Key person, occupational health physician. Occupational health practitioners are key factors to facilitate access to reliable information for workers and management, to promote understanding of the disease and its symptoms and personal preventive measures. Example, respiratory etiquettes, hand washing, self-isolation if sick. So they have all these things to be delivered to the workers as well as to the management by the occupational health physicians, and he is really a key actor. They should be support employees in the risk assessment process, that is identification of infectious and non-infectious hazards and assessment of associated risks, adoption of preventive and control measures, monitoring and review, as well as in the development or revision of the plans for prevention, containment, mitigations and recovery. Occupational health challenges and opportunities. Occupational health physicians face many challenges during this pandemic. We need to have more and more information. We have to gain a lot of knowledge how to react and act during this pandemic. And such conferences definitely a knowledge acquiring source. So we must attend conferences, gain knowledge either from conferences or for books. A critical challenge of occupational safety and health practitioners face is related to the variety of working situations that would need specific guidance, including healthcare and emergency response workers, those in essential activities, example, food supply and retail, utilities, communications, transport and delivery, etc. Unorganized workers, including informal economy, gig economy, domestic workers and alternative work arrangement, that is we have to do this working from home. Occupational health physician's role. Establish a pandemic preparedness framework. The occupational practitioner must work with the management of workers and prepare a framework, monitor the situation to determine a change in severity. Depending upon the situation, he has to determine change in the protocols. Review finance and treasury implications. Extend occupational health, clean workplace, personal hygiene protocols. Review HR policies and practices. Establish a pandemic communication program. This is very important. So there should be a perfect, transparent communication during this pandemic. Review the impact on business operations. He has to review time to time how the business is affected by this pandemic. Prevent the preventable. Preparation and prevention is better than cure, what we have learned during our studies in the medical colleges. Vaccination at workplace, very important. Vaccination from pediatric to geriatric in general population. Liaison with government, social organizations, local governing bodies. There should be a perfect coordination with such bodies, because without them we cannot work. We cannot propagate, we cannot percolate our thought for prevention of any infections or diseases, maybe bacterial or maybe viral. So you need to coordinate and cooperate with liaising like government, social organizations and local governing bodies. Preventive health checkups of workers and use of data. We have observed during this pandemic, if there is some underlying disease, such people are more vulnerable to the disease. Even they face death, severe disease. So we need to do a preventive health checkup of workers, and we have to preserve data to monitor workers' health. Health awareness like nutrition, exercise, good quality sleep, and spirituality is also very important. And hence we have learned a lot from this pandemic like COVID, and we have to prepare for future pandemic. Bad times have scientific value. These are occasions a good learner would not miss. Once again I'll read, bad times have a scientific value. These are occasions a good learner would not miss. Thank you.